Here at Virginia Mason Medical Center in Seattle, Washington, we focus our research on improving direct clinical outcomes for our patients. My name is Nikolas Sirs from Virginia Mason in Seattle. In this brief video, I describe the significance of our research, a randomized study evaluating pain and opioid consumption in continuous interscalene, supraclavicular, and suprascapular nerve catheters after rotator cuff repair. Traditionally, an interscalene block has been used for most shoulder surgeries. An alternative to the interscalene block is a supraclavicular nerve block. Both of the blocks have been well studied and shown to be effective for providing shoulder analgesia after shoulder surgery. Unfortunately, both of these nerve blocks have also been associated with varying degrees of phrenic nerve paralysis, which cause temporary lung dysfunction. The suprascapular nerve supplies the majority of shoulder afferents, contributing 70% of shoulder joint innervation. In the past, posterior blocks near the suprascapular notch of the scapula have been infrequently used for analgesia. A more novel ultrasound-guided approach near the origin of the suprascapular nerve in the supraclavicular fossa holds promise in that this technique locates the nerve quite shallow, allowing for ease of ultrasound visualization and needle targeting. The aim of this abstract was to evaluate the analgesia and opioid consumption after 24 hours of continuous infusion at these three varying locations along the brachial plexus: interscalene, supraclavicular, and suprascapular. Aside from these outcomes, pre- and post-block lung function was also recorded. Early data from this study reflecting PACU outcomes were presented last year at the 41st Annual ASRA Spring Meeting. In this study of 189 subjects undergoing outpatient rotator cuff repair, randomization placed subjects into three groups of 63, receiving either a continuous interscalene, supraclavicular, or suprascapular block. Each block was performed with a 15 milliliter bolus of 0.5% ropivacaine. A continuous infusion of 0.2% ropivacaine was started at 6 milliliters an hour in the PACU after assessments for pain and lung function. Briefly, early data from our study presented last year showed statistically similar analgesia in opioid consumption when subjects were evaluated in the PACU. As expected, blocks performed more distally along the brachial plexus, the supraclavicular, and suprascapular had better post-operative lung function in the PACU. In fact, subjects with a suprascapular nerve block preserved over 92% of baseline lung function. New data to be presented this year shows similar 24-hour pain scores collected in a blinded fashion. Similarities in pain scores were found both when looking at average pain, shown here in blue, and worse pain, shown here in green. 24-hour opioid consumption is also statistically and clinically similar between all three groups. Any difference in the mean opioid use between groups was equivalent to less than one oxycodone pill over 24 hours. Other outcomes presented here show similar patient satisfaction between groups. Side effects is where most of the differences in this study can be found. Echoing the objective PACU assessments on lung function as a whole, interscalene blocks had the most side effects and suprascapular blocks had the least. Further breakdown of these side effects shows much of the statistical difference comes from Horner syndrome, but the suprascapular group had the lowest absolute numbers in terms of hoarseness and dyspnea as well. In conclusion, the data presented here show that when evaluating analgesia alone, all continuous nerve blocks studied, the interscalene, the supraclavicular, and the suprascapular, provide excellent analgesia after rotator cuff shoulder surgery. What this data shows is that if preservation of lung function is a priority, a continuous suprascapular, or at least a continuous supraclavicular, should be considered as side effects were lessened with these blocks performed more distally along the brachial plexus.